Welcome to lesson number 2, Prism Connect Patient Management. In this lesson, we'll be covering the Patient Management tab. Let's take a quick look at the patient screen. This first section is a series of highlighted tabs is what we refer to as the Patient Management Suite. In this lesson, we will be taking a look at the Patient tab. This section of the Patient tab is the Patient Search and Status area. This section of the patient screen is about patient demographics. This section shows the results of the patient's latest hearing test. This section gives you a quick overview of any balance the patient has due or past due. This section shows any recalls the patient has scheduled. This section lists the patient's serialized products. This section lists the patient's current and past appointments. This button opens a window to custom fields. We will be covering each of these sections in detail, so let's get started. Let's take a look at Patient Search. If you know the patient ID, you can type it directly in, hit enter, and it'll pull up the patient record. If you don't know the patient ID, you can click on the magnifying glass icon, which will open the search box. You can search for a patient by last name, first name, address, city, state, zip code, or phone number. Let's search by last name. Type in the last name, click the search button, and you will get a list of people with that last name. Select the individual you're looking for and click OK. It will open that patient record. You can also search for a patient by invoice number. Punch in the invoice number, click search, and that patient will be listed. The last part of the search is by hearing aid serial. You can simply type it in, click search, and it'll pull up the patient associated with that hearing aid serial number. For this demonstration, we'll be creating a new patient record. To create a new patient record, simply click the New button located at the bottom of the window. We'll start by setting the patient status. Is the patient active or archived? An example of an archived patient would be a patient who is no longer in your area using your services, or possibly a patient who has passed away. Next is patient verified. This is the date that we physically verify the patient's identity. Next is HIPAA. This is the date which the patient has signed their HIPAA form. Up next is patient code. This is a user configurable code that can be used to define patients by your own criteria. It is also used in our marketing module. More on that later. Next is payment type. Will the patient be paying by cash only, private pay, insurance? Up next is Medicaid. Is the patient on Medicaid? If so, check the box and enter the Medicaid ID. Last up is collections. Is our patient in collections? If so, set the collections date. You will be notified at different points in the program if the patient is in collections. Now we'll need to fill in our patient demographic. If you notice, some of the fields are underlined and marked with an asterisk. These fields are required fields. You must fill them. Our first field is salutation. Type in the patient's first name, middle, and last name. Does the patient have a nickname? If so, enter. The full name is made up by the patient's first and last name. Enter the patient's address, to look up the city, state, and zip code, we have two nice little buttons. First one is Find by City. Simply click the button, type in the city name, hit your tab key, and you'll get a list of the city, states, and zips. Next is to Find by Zip Code. Simply type in the zip code, hit your tab key, and you'll get a list of cities that are listed under that zip code. in our case Minneapolis. Next is the patient's phone number. Does the patient have a cell phone? The patient's email address. And the patient's work phone. Next is patient gender. The patient's date of birth. The patient's preferred clinician. And the patient's preferred clinic. Here we have a box to list the patient's significant other. And their relationship to the patient. Our next grouping is a referral source. This also is a required field. Click the drop-down and you can pick from a list of predefined referral sources. We also have a sub-reference source. And a field for referred by. Was the patient referred by another patient or possibly a doctor? The next boxes are: would the patient not like to receive mail? Would the patient not like to receive phone calls? Or has the patient's phone been disconnected? If any of these are true, simply click the box. Our last box in this area is the patient physician. If we know the patient's physician and the physician has been entered, we can simply select them from a drop-down list. Here's the box for the discount program member. If the patient is a discount program member, the box will be automatically checked and the expiration date will be listed. In this corner is a box for notes. These are freely applied notes. Any notes can be typed in here. Before I forget, we also have an alternative address box. Clicking this button will open a window where you can enter an alternative address for the patient. Is the patient a snowbird? Do they travel to different areas at different parts of the year? If so, you can make note of that by entering that address here. Is someone else responsible for the patient? If so, we have a responsible party button and the relationship to the patient. Once the patient's demographics have been filled in, we can save the patient record by clicking the OK button located on the bottom bar. If at any time we'd like to make a change to the patient record, we can click the Edit button, make our changes, and then simply click OK again. Over here we have a Custom Fields button. To use this button, simply click Edit on the patient record, click the button, and it'll open a dialog box. These fields can be predefined by your clinic and allow you to collect additional information on the patient. You are allowed 8 fill-in-the-blank boxes and 2 yes or no checkboxes. As you can see, our new patient has no current balances, no recall schedules, no serialized products, and no patient appointments. Let's take a look at a patient who does have some records. Here we can see in the balances due area that our patient has no current balance due, nothing 31 to 60 days past due, nothing 61 to 90 days past due, however does have a balance 90 days plus past due. This gives us a quick little look at where our patient sits as far as what money they owe us. Down here we have our scheduled recalls. To create a scheduled recall, simply click the Edit button down at the bottom, then double click in our recall window, and you'll get the recall schedule pop-up box. To add or remove a scheduled recall, simply highlight the recall, click Add, and it'll be added to your list. Then click OK. Then come down and click OK at the bottom to save our changes. Down here we have a list of serialized products that are assigned to this patient. They give us a product type, the product description, the serial number, the battery size, whether this is our primary, secondary hearing aids for the patient, the sales date, and the warranty expiration dates, along with status and status dates. To view the information for a serialized product, we can simply double-click on that particular product. We will get a pop-up window with all the aid details. If we right mouse click on a product, we will get a pop-up menu that allows us to create a new aid or ear mold or edit an existing aid or ear mold. In this window, we have the patient appointments. This lists both future and past appointments. If we'd like to view an appointment, we can simply double-click the appointment, and the appointment details will be opened in the schedule. Underneath the patient demographics, we have a little box that lists the results of the patient's last hearing test. This will give us our right ear and left ear hearing loss, along with any issues, the date of the test, and a test no sale date if the patient was tested but purchased no hearing aids. In the bottom corner of the patient screen, we have 4 buttons: Patient Sheet, which will print out the patient's information; Labels, which can be used to print out labels for patient records; Envelopes, which can be used to print out an envelope with the patient's address; and Uploads. The Uploads area allows us to maintain documents for this patient. We could scan documents as PDF files and save them here simply by clicking Upload File. That concludes the Patient tab.